Today, we are announcing criminal charges against 19 defendants for fraudulent home health care schemes that targeted Pennsylvania's Medicaid fraud program and resulted in over $4 million of fraud. 18 of these defendants were charged in the last 12 days as part of a strategically coordinated law enforcement operation between the Fraud Division, the U.S. Attorney's Office, and the Pennsylvania Attorney General's Office. The cases today build on the work that we recently announced in Minnesota, where we charged 15 defendants for systematically looting 7 state-managed Medicaid programs out of more than $90 million, treating those programs like a piggy bank until one of them had to be shut down entirely because there was nothing left. The shelves were empty. The Commonwealth of Pennsylvania is one of the highest spenders for home care services in the nation, with spending on home care services exceeding $8 billion in 2025 alone. These home care programs are designed to allow America's most vulnerable to live with dignity at their own home, instead of being forced to leave their families for a nursing home. The program is innovative. It allows friends and family members to receive funds from Medicaid to provide necessary physical care for a loved one. Used properly by honest citizens, the program allows those with physical ailments to be cared for by those they trust the most. But infiltrated by greedy and deceitful opportunists, this program becomes a money tree, a gravy train for criminal fraudsters. The cases today make that abundantly clear. They are not paperwork errors or good faith accounting errors. They involve supposed home health aides who billed the taxpayer for home care services but never actually provided those services, and supposed Medicaid patients who conspired with other fraudsters to bill the taxpayer for completely unnecessary health services. In one case, we charged 2 home health aides and 2 purported patients with causing over $400,000 in false claims to Medicaid for services the aides supposedly performed when, get this, they were actually hospitalized, working at other jobs, and even in jail. Yes, the allegations include a scheme that billed taxpayers for home care services provided when the person supposedly doing that work was sitting behind bars. That, of course, is not health care. It's just pure theft. Another indictment charges a father and son for engaging in a fraudulent Medicaid scheme. In short, according to the allegations, the father didn't need the care and the son wasn't giving it. The son claimed to be providing services to his father while he was actually working as a driver for a rideshare and food delivery service. And in fact, on one occasion, the defendants allegedly billed Medicaid for services that supposedly occurred at the exact time the son was in the midst of a traffic stop in which he was cited for possession of marijuana. On another occasion, on the very day that the son billed Medicaid for a full day of in-home care for his father, the father was not home at all. He was in a courtroom watching a different relative get sentenced for defrauding this same program. These fraud schemes not only rob Americans of their hard-earned money, they also steal the trust in our communities, destroy the public's confidence in our public benefit systems, and perhaps worst of all, sow seeds of doubt that honesty and hard work is the right path after all. That is why justice matters: to punish the wrongdoer, restore hope to victims, and to deter others from choosing the wrong path. And justice is on the move. Earlier this year, we announced a new West Coast healthcare strike force to combat fraud in California, Nevada, and Arizona. We have also announced a Medicaid strike force approved by Acting Attorney General Blanche to mobilize 15 additional fraud prosecutors nationwide to combat Medicaid fraud. Just last week, we convened a historic federal-state partnership event in Columbia, South Carolina, where leaders from across 7 states in the Southeast gathered to strengthen coordination and expand joint anti-fraud initiatives. And we have launched a historic $300 million grant program to allow state and local prosecutors to join the DOJ and fight fraud and other crime. I thank Attorney General Sunday for being one of the very first offices to join our grant program, and we look forward to receiving multiple special prosecutors from the Attorney General's office in the near future.